Good morning and welcome to the San Francisco Interfaith Council online briefing for community and faith partners. In today's program, our speakers will highlight the fact that COVID does not take a vacation and tell us about the status of COVID-19 in San Francisco and how to stay healthy. A big thanks. The San Francisco Interfaith Council online briefing is supported by a grant from the Center at Sierra Health Foundation. Thank you. The important and ongoing work of the San Francisco Interfaith Council would not be possible without generous funding from congregations, corporations, faith-based social service agencies, foundations, judicatories, and supporters like you. Help us spread the word. Visit sfinterfaithcouncil.org to learn about SFIC programming and how to become a supporter. Follow SFIC on Facebook and Twitter, and subscribe to SFIC's YouTube channel to watch all of our virtual events. A bit of housekeeping. This program is being recorded. For audio, all participants are muted and without video to minimize distraction. To submit a question or comment, select the chat button at the bottom of your screen and send a message to Q&A. Questions will be forwarded to the host and answered time permitting. For closed captions, select the live transcript button at the bottom of the screen and click Enable Live Transcription. And at this time, I'd like to hand the floor over to the Executive Director of the San Francisco Interfaith Council, Michael Pappas. Michael, the floor is yours.
Thank you, Trey. Good morning. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this week's online briefing for community and faith partners. As we enjoy the summer season, it's important to remember that COVID-19 has not taken a vacation. This week's online briefing for community and faith partners, hosted by the San Francisco Interfaith Council, features San Francisco Health Officer, Dr. Susan Phillip, and San Francisco Department of Public Health Director of Communicable Disease and Control Prevention, Dr. George Hahn, who will provide an update on the status of COVID-19 and other communicable diseases in the city and share recommendations on how to stay healthy. As we do at the beginning of each of these convenings, allow me at this time to read our interfaith statement. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer prayer in this setting, it should be offered according to the tradition with which we identify. If we're invited to speak on a subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other, that we might better understand the multiplicity of faith traditions in our city and in our world. What distinguishes us, the San Francisco Interfaith Council, from other organizations is that we do come to issues like today from a perspective of faith. And with that, we are very blessed to welcome Reverend Dr. Jonathan Butler, who is research faculty in family and community medicine at UCSF Medical Center, Associate Director of Black Health Initiative for UCSF, and we also know him as the Director of the African American Faith-Based Coalition, and we at the San Francisco Interfaith Council are very, very blessed to call him our Vice Chair. Dr. Butler, welcome. It's a blessing always to have you with us, and we look forward to your reflection to ground us in this moment.
Thank you, Director Pappas, and hello to everyone. Good morning, and I'm certainly appreciative of this opportunity. And reflecting on this morning, I'm reminded of a scripture in Jeremiah chapter 29, verse 11. Some of you may know. It reads, "For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future." And this verse is often cited to provide comfort and reassurance, especially during times of turmoil. It reminds us that God has a plan for all of our lives, one that is filled with hope and positive outcomes. And even during difficult times, this particular scripture is one that I go to often. It helps me to understand that there is a need for us to trust in God's wisdom and God's timing, knowing that God is working towards all of our good, as individuals and collectively as a community. It emphasizes the idea that hope is not just a fleeting emotion, but a promise from God for a prosperous future. I'm reading a book. It's called Dare We Speak of Hope by Alan Bosak. He is a South African theologian, and he deeply delves into this concept of hope amid oppression, drawn from his experiences in South Africa's anti-apartheid struggle. Now, Bosak dissects hope. He underscores its resilience and transformative power, igniting a call for justice and equality. And this reflection on hope aligns profoundly with the conditions we face in our country today, when we know that there are always social inequalities, racial injustices, economic disparities, and this continued struggle for equal rights, especially as it relates to our health, and particularly in the wake of this tumultuous political climate and systemic racism which we face. Bosak's narrative prompts us to reimagine a future where hope underpins resilience and determination. And in our context, I'm certainly proud of the recent news that has happened in the rise of Kamala Harris. Not only is she the first female Black and South Asian vice president of the United States, and who serves as a beacon, in my estimation, of this very hope. Harris's ascent challenges even historical and systemic barriers, demonstrating that progress through very slow and often arduous progress is attainable, and she is continuing to break barriers, and she embodies this hope that Bosak speaks of. And Harris' potential presidency represents not just political achievement, but this social milestone, instilling a sense of possibility for marginalized communities. And this reflection urges us to comprehend hope not just as this passive optimism, but this active engagement, this relentless pursuit of justice. And I think Harris's journey and position symbolizes this active hope, motivating us to persist in our struggles, advocate for equity, and believe in the power of systemic change. And so, I just wanted to leave you with some of the lessons that I've learned from Bosak's books, Dare We Speak of Hope, especially in the climate that we're in politically, but also as we are in this ongoing challenge with this COVID pandemic. Is the power of hope in adversity that he teaches us, Bosak, that is, that hope is not this naive optimism, but a powerful transformative force. It thrives even in the face of severe adversity, serving as a beacon for those who are on the margins of society, those who are oppressed in their communities. And this lesson is, I believe, crucial today as we navigate through all of these injustices that we face. And then hope is also deeply entwined with action. It calls for active participation in the fight for justice, that we are all in this together. As a matter of fact, I just recently came from a NAACP National Convention, and the title was All In, that we have to all be in this thing together. And so this active engagement and activism of this hope that we aspire to, it translates into engaging in social activism, advocating for policy changes, supporting grassroots movements, and voting for representatives who align with the values of equality and justice. But he also, Bosak, that is, emphasizes the importance of community and solidarity in fostering hope. And today, this lesson manifests in collective efforts to address issues that we speak of, especially around racial injustice and economic disparity, and even environmental degradation. It underscores the need to support one another, build inclusive communities, and work together towards this common goal. And this is a call to action to ask, are you all in? Are you all in to this hope that we all aspire to, where everyone has an equal opportunity to the finer things in life? And so this hope that Bosak is that's speaking of, that I'm reading about, it reminds us that the pursuit of justice is ongoing. It requires all of us. It requires persistence, courage, and an unwavering commitment And in the context of the social issues that we face, it means continuing to challenge those injustices, support reforms, hold systems accountable, even when progress seems slow, as it has been. And that is our moral and ethic responsibility. That it is vital to urge leaders and citizens alike to act with integrity, fairness, and a sense of justice. It highlights the need for ethical governance and policies that prioritize human dignity and social equity. And so in essence, I just really wanted to leave you with the lessons of hope, activism, community, inclusivity, justice, morality, historical awareness, and dialogue to provide a robust framework for addressing the issues that we will continue to face as a nation. But the challenge for us is to, again, be all in to making sure that we play a role in ensuring that those who are on the margins of society come to the center. And so I just want to leave you with this reflective moment and this question that BOSIC raises: dare we speak of hope in the midst of all of the adversities that we face in our lifetime? There is still hope. There's a song that I used to sing in college. It says, yes, there's hope for the world. There's an answer for the world. As sure as there's God, there is hope. Thank you.
Thank you, Dr. Butler, for your prophetic voice. And I just want to assure you we're all in.
Thank you.
We are very, very blessed to welcome back Dr. Susan Phillip, the health officer for the city and county of San Francisco, and Dr. George Han, the director of Communicable Disease and Prevention and Control. I think we owe you both a great debt of gratitude, because these briefings that we have originated out of the health officer, actually the associate health officer, back in March of 2020, when we didn't know what Zoom was. And the associate health officer wanted to meet with clergy at that time. And he said, click on, register for this link, this thing called Zoom. And when we did the debrief after the initial meeting, he said, you have to do this every week. And I laughed at him, and he said, we will provide you with the tech support and the platform, and the rest is history. And we have produced well over 100 of these briefings. And even though it all started with COVID, I shouldn't say even though, COVID continues to haunt us today. And just in the past week, we saw in the San Francisco Chronicle a report of spikes in hospital beds being taken by COVID patients. And so the relevance of this conversation today could not be more timely. We welcome you back, both of you, because you've been such great partners in our work and helping communities of faith to respond to this pandemic. And we would welcome you now to share with us your wisdom and how we can help you in the fight against COVID.
Thank you so much, Director Pappas, and I'm so glad to be with you. I'm going to hand it over to my colleague, Dr. Han, who really is our subject matter expert on communicable diseases, including COVID. And but I want to say that I personally am thrilled to be back to join you all, and to thank you all for the ongoing work of caring for your communities and your congregations that we know that the council members have done since COVID and before that and after that. So thank you so much for the privilege of being here, and I will turn my camera off, but I will be back for the Q&A portion. So looking forward to talking with you then.
And thank you so much, Dr. Butler, for your inspiring message, and Dr. Pappas for your invitation to come speak again. I was last year speaking on COVID in January when we were having an uptick of COVID at that time, and we're currently experiencing another one now. And thank you, Dr. Phillip, for staying on with the Q&A, because I will need to attend to another item in a little bit. So without further ado, we will go ahead and move to the next slide. All right. So a quick update on where COVID-19 is in San Francisco. As you all know, it's been on the rise in recent weeks and months. Wastewater levels of COVID-19 are currently high in San Francisco and statewide, and you may have heard going up in the whole country. San Francisco's 7-day average of COVID-19 test positivity is most recently around 7%. But there's a caveat there in that most people aren't actually using PCR tests anymore, as you know. To test for COVID, they're using rapid tests at home, so that's not being measured by this test positivity rate. What the positivity rate is useful for, though, is the fact that it has been increasing, and that shows what the trend of COVID is. And as was mentioned earlier, hospitalizations have been rising, but rates still do remain lower than they were this past winter. In the next slide, we'll talk about really the most important thing anyone can do at this point is to get vaccinated. So you may recall that last fall, there was a new updated COVID vaccine that came out, and that vaccine was recommended for everyone 6 months and older. So if you haven't gotten that, that's definitely recommended. And anyone who's 65 years and older was then recommended to receive an additional dose of this updated vaccine if it's been more than 4 months since their last dose. So if you last got your COVID shot in January, let's say, it's definitely time to get it again. And interestingly, there will also be a new updated vaccine for COVID. We could call it the 2024-2025 COVID vaccine that will come out this fall and through pharmacies and doctors' offices. And if you get the vaccine now, you will probably need to wait about 4 months before you get the next one. But I would say that is still worthwhile to do because we're currently in an increase of COVID. And so it's best to go ahead and get protected. Remember that the vaccine does decrease your chances of getting COVID by a little bit, but most importantly, it decreases your chances of getting hospitalized, seriously ill enough to be hospitalized, and it decreases your chance of getting long COVID. So I do think that it is worth getting the vaccine now if you have not gotten your 1 or 2 shots, depending on your age, this past year, and then getting the next one when you're eligible to do it later on this fall and winter. For now, people without insurance are still able to access vaccine through the Federal Bridge Access Program. It does end next month, however. But at the moment, folks can still visit vaccines.gov to find a location, and Walgreens, CVS, etc., are still offering that free vaccine. Otherwise, people with insurance or regular doctors will still be carrying the vaccine. So on the next slide, let's see, we'll be talking about other treatments and medicines. So you remember Paxlovid, it's still here, still continues to be available. You take it, it's an oral medicine, and it lasts for 5 days. You take it basically as soon as you find out you have COVID, and if you're at higher risk for increased risk of severe COVID, and that includes a lot of older individuals and people who have other medical problems. There's also, for people who are moderately or severely immunocompromised, there is this new monoclonal antibody called Pemgarda, which was authorized by the FDA in March for the prevention of COVID. And this replaces the previous Evusheld, which stopped working because of the evolution of the COVID virus. So this one is authorized and it can be administered every 3 months if deemed necessary by your physician. So that's an important tool that we have for people who are immunocompromised. All right, and then of course there are always additional steps that you can take for health, and so first one is staying home when you're sick. If you feel sick, of course, test for COVID right away, and then you can act quickly to get medicine such as Paxlovid to prevent the illness from becoming serious, and so that's why it's important to test for COVID as soon as possible. Your insurance may still be able to provide you a free at-home test. And then during times when COVID-19 is circulating, such as now, you consider wearing a well-fitted mask such as a KF94, KN95, or N95 in crowded indoor spaces. One good rule that I think tends to work well is if you start noticing folks in your circles starting to get COVID, you know that it's probably time to kick up your protective behaviors up a notch. And aside from wearing masks, improving of ventilation. So first of all, having more events outdoors, but if it is indoors, to open your windows, turn on your HVAC systems, use air filters. There's a lot of different ways that both congregations and individuals can improve the quality of the air that they breathe, which can help with preventing COVID. And other diseases, I might add. It works for many respiratory viruses. All right, and I think the next slide is yes. So speaking of masking, the San Francisco health order that did require healthcare workers to wear masks did expire. And so what that means is those healthcare facilities can decide to implement their own requirements. And so what the San Francisco Health Network has done was they decided to continue requiring their staff to wear masks when working with patients. And what the Department of Health recommended is that health systems implement policies that staff would mask upon patient request if their policy doesn't already require that masking. So I think that's it for COVID. And we thought we would give a little bit of an avian flu update, since you may have heard about bird flu in the news. So I'll just touch quickly on what this is. So avian influenza is otherwise known as, so there's many different kinds of avian flu. One of them is called H5N1. And that is the specific one that has been generating a lot of interest in the last few years. So this specific virus is a new virus from a couple of decades ago. It's been spreading for several years, and at this point now has infected millions of wild birds and birds on poultry farms, including in California, including wild birds in San Francisco. And the reason this is relevant is because people can also get this virus. So far, though, it's been mostly in birds. And so recently, though, the reason it's been in the news a lot is because it started infecting dairy cows. And so at this point, it's now been detected in dairy cows in 13 states. California is not among them, which is good because California happens to be the largest dairy state in the country. So there's lots of monitoring going on to ensure that we are able to, or the agricultural folks are able to detect the virus quickly if it does come to California. So I mentioned before that people can get it, but it's pretty rare so far. So since 2022, there have been 11 reported cases of bird flu in people. And these have all been among dairy farm workers and poultry farm workers. And so the states that these 11 people were in were Colorado, Texas, and Michigan. So no human cases in California as of yet. And there is currently no evidence that avian flu is spreading from person to person. Now, if the virus changed or mutated and it was spreading from person to person, that would be of concern, because then it could potentially spark an outbreak among people, or even an epidemic or a pandemic. But the good thing is right now, it's not spreading from person to person. It's really spreading from animals to people. And so the public health efforts are focused on ensuring that people are not getting sick from being in contact with their animals. And so the potential for avian flu to become widespread among humans remains low at this time, and we continue to monitor at the state, local, and national levels. I thought I would give a little bit of an update on the wastewater, because we do participate in Wastewater Scan, which is a national collaborative that monitors infectious diseases through municipal wastewater systems. And there were fragments of avian flu that had been detected in the wastewater in San Francisco, and it has been detected in other jurisdictions in California, as well as the United States. However, what we know about San Francisco is that we have a sewer system that collects and treats both wastewater and stormwater in the same network of pipes. And so it's possible that these avian flu detections were from wild birds, because we know that wild birds have this avian flu. We think that the risk of the public remains low, and we will update the community if there's any actions that are needed to be taken. And a little bit about wastewater surveillance. So wastewater surveillance is a relatively new method of monitoring disease trends that began during COVID. COVID was the first virus to be tracked using this method. So scientists understand how to interpret COVID wastewater data better than other viruses, such as avian flu. So what we know with COVID is that when COVID wastewater detection increased, that means that infections in the community are also increasing. And we do partner with the California Department of Public Health, the Wastewater Scan Collaborative, and other health departments to interpret and understand what wastewater data means as the science evolves. So that's just a little bit about wastewater and how it's kind of a new tool that we're trying to use to understand communicable disease trends. And it's a really interesting tool that continues to evolve in our understanding. And I think that might be it. So yes, thank you so much, and we will be happy to answer any questions.
Thank you so much, Dr. Han. And I know that you're going to have to pop off, so we welcome Dr. Phillip back. A longtime member of the SFIC, Nancy Sheffield-Gomes, asks, is Paxlovid still recommended to lessen the severity with this strain?
George, do you want to take that question? Maybe your first and last question.
Yes, my first and last question. Thank you. Yeah, no, Paxlovid is still recommended if you're at increased risk of developing severe COVID. And folks who are at increased risk are folks who are older or have medical problems. Best to consult with your doctor to see if Paxlovid is right for you. But the first step, of course, would be to take the test to know that you have COVID, and then find out if you should be taking Paxlovid. But in general, folks who are older should be taking it.
We have a question here. Is there a vaccine available for H5N1? And have any wild birds tested positive for H5N1 in the city and county of San Francisco?
Yes. Well, let me answer the second part first. Yes, wild birds have tested positive throughout California. So we do know that it is present in wild birds. And as a result, in California, it has also been detected in flocks of domesticated poultry. And that's a lot of where the transmission goes back and forth. So we do know that it is in wild birds. And one of the recommendations that we have as a result is that if the public sees a dead bird or a bird that appears really ill, don't handle that. It's best to call 311, and they will notify animal care and control, or they'll notify others, because we are trying to understand, are there large numbers of birds that are getting sick and dying in San Francisco? but it certainly is present in wild birds here. In terms of vaccines, there is not a widespread recommendation for human vaccination at this time, because there's not a widespread general threat in the population. As Dr. Han was saying, the biggest concern that we have is that as this virus is in different populations of animals, as it's in wild birds, then it gets into domestic birds, which interact with humans, they're human caretakers. As it goes into cows, now it's suddenly from birds into mammals, which are a little bit, closer to our physiology. That's also a concern. And what CDC has been tracking is the states, as Dr. Han said, there have been some dairy workers that have been infected from coming into contact with cows. So the focus right now is on those types of agricultural and farm workers and taking a lot of preventive measures, including personal protective equipment in working with those animals, not so much on vaccination. But the real concern, of course, is could the virus change further so that it's able to spread human to human? The people that have gotten sick so far, it's been very mild. They've had some cold-like symptoms and some conjunctivitis, some redness and irritation of their eyes, but it hasn't been severe. So we are watching public health globally, nationally, and in the state and in here in San Francisco. We're watching this really closely. But right now, it's more that we need to be aware rather than there being a specific vaccine or a specific action that we need to take.
More robust questions on this topic.
You're a great question.
Does Public Health have a kill order for flocks of poultry being raised commercially if one tests positive for H5N1?
That is the intervention that happens. It's not us in public health, either at the local level or the state. We work with our colleagues in the California Department of Food and Agriculture, and they are the ones that monitor the welfare of animals and the health of flocks. And unfortunately, in poultry, the virus spreads so quickly, and it does result in fatalities. And the only way to control it, because of the rapidity of spread, is to actually cull entire flocks. So that is something that has happened. And I think we have seen in the past few years, there have been fluctuations in availability and price of eggs and poultry and those types of things as California and other states have experienced this. So it definitely is an ongoing situation that's being monitored by the U.S. Agriculture officials, as well as in our state level, and public health at the state level. And we as well are interacting with them and thinking really carefully because of this interface between humans and domesticated animals.
One last question for the moment on H5N1. Is there anything we can do to protect ourselves from H5N1 avian flu?
Yes. Yeah, that's a really wonderful question, and what a great opportunity to address it. It is not a general threat. It's not a threat to the general population. So as opposed to, several years ago when we were talking about COVID as it was starting, and even now, there's not really a risk as we're going about our day-to-day lives of avian flu for the reasons that Dr. Han outlined. This is not spreading person to person, so we're not going to encounter it in our day-to-day lives interacting with each other. It is relatively rare to have transmission from animals to humans, and it occurs primarily in agricultural workers who have really close interactions with those animals, with cows or with poultry. And so that's where the focus is. Those are the folks who are at somewhat higher risk. And so that is why government officials are working to get masks and gowns and gloves and all of those things to those workers to try to decrease that risk. But for the rest of us, no, H5N1 is not something at the moment, thankfully, that we have to worry about in our day-to-day lives. Here at SFDPH, we are monitoring this really closely. If anything were to change in that situation, we would be making clear announcements. We'd be asking Dr. Pappas if we could come back and speak with you all to give an update. But luckily, as of now, no risk to the general public from H5N1.
Thank you. Back to COVID. Is it too late to get the COVID and flu vaccines?
Well, let me separate those out. For the flu vaccine, it is too late for this year. That is generally We see seasonal influenza, and that's what we're vaccinating against. So that is in the fall and the winter. So keep it on your calendar to ask again, or to look for it with your provider or your pharmacy in September, October. For COVID, it is not too late. If you have not received the formulation that was from, the winter of 23-24, like between November, October, and January, February, you can still get that. And if you are someone who has not had that version of the vaccine that came out in the fall last year, and you are concerned because of your underlying health, or because people around you are getting COVID and you would like the benefit of the vaccine, you can go ahead and get that. There will be a new formulation that's coming out, likely in September, October is probably more realistic. And you do have to wait about 4 months, has been the recommendation between vaccines. But do not wait if you are someone who could benefit from the vaccine, would like to have that extra protection. You can go ahead and get that now, and it is available. As Dr. Hahn mentioned, people who are underinsured or uninsured, the federal government had been providing doses of vaccine. Unfortunately, the Congress did not reauthorize spending for that program, which is really unfortunate, but it will end in August. So now would be a good time to go and access those vaccines, and to let your communities and congregations know that it remains available through large pharmacies. It's called the Bridge Access Program. And you're able to, access it through Walgreens and other pharmacy programs. But that will be ending in August because the funds have run out.
From Pastor Odette Lockwood Stewart from Park Presidio United Methodist Church, do you have guidance or counsel now for COVID or flu for faith communities with vulnerable populations regarding best practices for masking, distance, numbers, intergenerational practices when ventilation or HEPA equipment is not possible in worship?
Yes, and thank you for that question. And we know that it has long been a delicate balance of all of those considerations, and knowing that there are times when in-person worship and in-person gatherings are really important and should be happening. And we know that the interconnection and the continuation of faith practices are important holistically for people's overall well-being and spiritual as well as physical and mental health. So we want to support those things. And it's a really great question to say, what are the steps that a congregation can take in order to do that in the healthiest way possible. You mentioned sometimes it is challenging with ventilation, but that is always a good thing to do, to try to optimize that to the extent possible. It may not be able to be fully outdoors, or fully with open windows, or fully with HVAC system, but increasing circulation however is possible is always a good thing. Making masks available to people, and encouraging people who might be older or might have chronic illnesses to use their own well-fitting masks. They may want the higher quality of masks, as Dr. Hahn put in the slides, which include the N95 or the KN94s. Those have a little bit more protection and filtering than regular surgical masks. But certainly making those surgical masks available to others as well as they come in to services is always a good thing. And then, very importantly, I think hopefully if one good thing comes out of the pandemic, it's for us to all realize if we are not feeling well, we should not be going into spaces with others. And if people are sick, they should stay home. And encouraging and supporting that from your leadership positions is also a really good way to try to help keep people as healthy as possible. And again, as Dr. Hahn said, not just for COVID, but for any respiratory illness. We know that in the fall, we worry about not just COVID, but also influenza and RSV, which is another virus that causes respiratory illness. So in multiple ways, hand washing, staying home when sick, getting the vaccines that are available are all important things to consider. And I do believe that we can gather safely using those precautions. And then for people really doing what they feel is comfortable for them, and under the advice of their under the advice of their clinical provider, physician, or other care provider as well.
I was on a Zoom yesterday, and a colleague of mine who is very sensitive to COVID noticed I was sniffling a little bit, and she said, "Have you tested?" And because I had a in-person meeting yesterday, immediately I did, and thank God, negative. But
Yeah.
how often should we test these days?
I think that when you have symptoms, that is good, and ideally, if you test negative and you have symptoms, you might want to proceed as if you might have COVID, meaning maybe mask around other people, and then test again in 48 hours, because it does take sometimes a little while for the test to become positive. I would say that's particularly important in a time like now, when we do know that there is more virus circulating in our city. And the other time to test would be if someone tells you, "Oh, I had COVID, I didn't know it, and we were together." If you've been exposed, that's another time to test 24 or 48 hours to really have a sense of whether you might have gotten COVID from that exposure.
On the issue of RSV, if someone got the RSV vaccine last year, do they need to get it again?
That's a really wonderful question. No, you do not need to have it again. It is great that you got it last year when the reminders came out. So that is not a vaccine that you need to get repeatedly. And that differs from flu and what seems to be the trend now with COVID, in that they come up with new formulations to match the circulating strains. And so it does seem as though we will be needing to get boosters or new variations of those vaccines, maybe on an annual basis.
Okay. Now here's another question. Where can I find wastewater data in San Francisco?
Yes, that is a great question. Monitoring the wastewater data is a way of sort of understanding generally what's going on, like how much COVID might be circulating. And that can be identified through wastewaterscan.org and typing in San Francisco. And we'll make sure to send that to Director Pappas and to the organizers, so that it can be sent out with the meeting notes, and so people can have that.
Excellent. From Sue Yip, I have had many friends who tested positive days after their symptoms, 3 to 4 days later. So delayed results seem to be a thing now. Do you want to address that?
It can certainly happen. I have not seen studies or data to suggest that there's systematically something different about COVID now than earlier, causing that to be the case. But it is always possible that very early on the symptoms are developing before the actual detection is possible for these tests. So that is why, if you have a high suspicion, because a lot of people have been diagnosed with COVID around you, because you know that there's higher levels of COVID in the general community, as there is right now in San Francisco, then it's good to suspect that it's possible that you have COVID, even if you test negative initially, and to retest a couple of days later. I think then the precaution would be, if you're around people that might have a higher susceptibility to becoming ill, then to take precautions such as wearing a mask yourself when you're around other people, or staying home until your symptoms have largely resolved.
I suspect down the road we'll probably devote an entire segment to long COVID. I'm just wondering if there is a word that you have for people who have it, and a word for people who are concerned about it, and how to avoid it.
Yes. Long COVID is one of the most vexing challenges of the pandemic. We have all lived and suffered and struggled through sort of all of these waves. And for people who have developed long COVID, we know that it can be quite a challenge and take a long time to resolve. And for some people, symptoms continue on. So we know that is a big challenge. I think science and public health and medicine is still grappling with what exactly that means. What are the predictors? What are the ways in which the symptoms can be treated? How can people who have long COVID get relief? So a lot of attention as well in public health is what can we tell people about preventing long COVID? And clearly the prevention tools that we are always reminding people of that are available to us are ways to do that. If you do not get COVID, then of course the risk of long COVID isn't there. And most of us are not going to be able to entirely prevent getting COVID because it is ubiquitous and at some times, and we do need to go about our day-to-day lives and interact with each other. But we can take the steps that we talked about. There is more and more data that vaccination is protective against long COVID, so that even if you do get COVID, you're less likely to develop the long-term symptoms. So again, yet another reason to stay up to date on COVID vaccines and to get the updated formulations when they become available. And then the other strategies to try to prevent getting COVID, including using masks when case rates are higher, when you're in crowded situations. In most situations, I'll just give you my personal example. I don't use a mask for the most part, going to the grocery store, going into a house of worship or other places. But when I'm taking public transit, I'm one of the few people that does it, but I still wear a mask because to me, I am not interacting with people and talking there, and why not? You know, sometimes it's crowded and I will go ahead and wear the mask. So making those kinds of decisions based on your comfort level and really what works for you is a good way to consider it, and just know that masking, it continues to be an option. And even though it is not mandated for the public as it was in the earliest days of COVID, when we didn't have treatments or vaccines or prevention tools, otherwise, it's still a good option. Dr. Han also mentioned that there is a preventive treatment that can be given for people who have chronic diseases or underlying challenges to their immune system. The trade name is PEMGARDA, but which should be available for people who are under the care of a provider to find out if that might be another way in which to add to protection against COVID-19.
I know from your lens and your area of expertise that you've devoted your life, you've seen a lot in the time that you've not only been health officer, but in your whole medical career. And I think you might have even touched on this. I suspect as a society, we're going through COVID fatigue. And I'm just wondering how to balance the vigilance that we need to have to combat it with getting on with life. And do you foresee COVID as in sometime in the future as being treated and seen the same way as like the common flu?
You know, I think that is such an important question, and that is what we are balancing, what we are always balancing, you know, individually when we make our decisions and think about our health, but collectively as a society and here in San Francisco. What I think is that I do understand the fatigue, and I don't think that we should think about COVID in the same way that we did in the spring of 2020 when the council, you know, first came together to really understand this unknown threat and try and know what we learned what we could, and it was so much was unknown. We know so much more. We have so many more tools now. We also know that there are harms that come from not gathering together to worship or have meals or go to school, all of those things. So it is a good thing that people are now able to do all of those activities. We do know that there are still people who remain vulnerable to COVID. So I don't want us to forget that, and we do need to be sensitive to the needs of others, which is why I really appreciated and loved the question about how to keep people who might be more vulnerable in our faith communities safer and in our communities overall. And we should be continuing to think about that. And I think that goes along very well with the ethos of so many faith traditions, that we do watch out for those among us who might be more vulnerable. But I think that it will become a balance. It will continue to be a balance. What I don't want is to swing so far to the other side that we are no longer hearing or understanding the messages about, you know, get the vaccines regularly, use masks when it might be appropriate. We need to really be able to take and use the tools that we have. And so I think that I have full faith that San Francisco will continue to do that. COVID, is not causing as much severe death and severe illness and death as it has before, but it can still be quite a serious illness. It can result in hospitalization and death as well. So I think we have to have a healthy respect for what the virus can do while we're navigating, the reality that we no longer have to fear it in the same way as a completely unknown threat. And then in public health, we're always watching out for what the next thing could be. Hopefully there is not another novel virus pandemic in our lifetime. And in some ways, H5N1 avian flu, we're starting from some basis of knowledge there because there have been other influenza outbreaks and global epidemics that have happened in the past. It's not a completely new virus the way that the coronavirus was. So I think we're overall in a good position, but again, with climate change, with changes in migration and the borders between animals and humans changing all the time globally, there always is a risk of a new emerging infection. And that is our job in public health, to really be the sentinels and scan the horizon and work with our colleagues, globally and nationally at the state level to try to keep San Francisco as informed and as safe as possible. And that's the mission that we will continue to do.
Thank you. From Yoshi Yao, it's more a statement, but I would invite your reaction to it. He says, I was shocked to learn that a relative who was traveling to Asia was told by his travel agent, and this person, I guess, had tested positive, that it would be okay to travel even after testing positive for COVID.
Yes, I think that is a difficult situation. I think from a public health standpoint, and maybe as the person sitting next to that person on the airplane, I would hope that people would not be traveling. But I also understand the challenges and the pressures of wanting to take the trip and potentially losing money and time and that enjoyment. I think it's really difficult. But I think that it is best not to expose others if it's at all possible. But I'm not surprised that may not be the message that everyone is getting or delivering, because it becomes quite difficult. It causes so many problems in many ways when those disruptions continue to happen. So it is quite a challenge. I'll just say that. I can understand how people have a hard time making those decisions.
A final question. When I was in seminary, the sermon that I gave for my senior year was that comparing houses of worship to hospitals for wounded souls. And they are, and our clergy are working as physicians, if you will, in a way. And so the question is, what role do faith leaders have in helping people to stay healthy?
I love this question, and from the very first moment that Director Pappas invited me to join you years ago, that is the way that I have seen it. I think that your work is very similar to mine in that we're caring for communities. You are also tending to individual souls, as you said, individual people, but you're also really tending to family units, to networks, to communities, and keeping people as healthy as possible. And we know that health is not just the absence of disease; it is a state of flourishing. And for many people, their faith traditions and their faith communities are that source of flourishing. And the mental health benefits, the physical benefits of being together are numerous. So I so appreciate all of you that have continued to stay informed, and for the forum that Director Pappas has really nurtured to keep health information front and center for you all as leaders in community. And the ways in which you've applied those things to the benefit of the health and protection against communicable diseases like COVID throughout the pandemic and ongoing. For whatever the next challenge is going to be, you all will be core key partners in our public health efforts. So I'm so grateful. I recognize that you all multiply the messages, the impact, the assistance, right? Sometimes there's physical assistance that people are providing each other in the communities to take people to get vaccinated or to assist in other ways. So very, very thankful, and I'm very aware of how important your influence, your reach, and your services to the communities that we all care for mutually and want to stay as healthy as possible.
That we have you with us, I just want to say thank you. Many of us in the faith community look upon those in the medical community as the hands of God at work, bringing about healing. And I just wanted to assure you and your colleagues at Public Health, and also the physicians at all of the hospitals and throughout the city, that we continue to pray for you as you do your work and try to keep us safe. So thank you, Dr. Phillip.
Thank you so much. It is so appreciated, and such a joy to be with you all today.
This brings to a close today's program. We would invite you to join us once again on August the 8th, when our online briefing will shine a spotlight on California Proposition 5, which would reduce the threshold to pass bond measures and its accompanying regional measure 4, the $20 billion 9-county affordable housing bond. As I mentioned, this brings to a close today's program. We thank you for joining us, and God bless you and God keep you.